Senator Grassley is next, and we welcome him.
Thank you, Mr. Chairman. I'm going to lead into a question for Dr. Benton. In September, the DEA issued its first public safety alert since 2015. It warned of a significant nationwide surge in counterfeit pills that are mass-produced by criminals in labs, deceptively marketed as legitimate prescription drugs. These counterfeit pills are killing unsuspected Americans, particularly young people, and it's at an unprecedented rate. Many youth are getting illicit pills knowingly or unknowingly through Snapchat or TikTok. This use of illicit drugs is driven by mental health challenges, anxiety, suicide thoughts, and resulting in accidental overdose deaths. So do you believe that kids dying of suicide or accidental drug overdose is driven by mental health challenges?
So thank you for that question, Senator Grassley. And it is a complicated one. And so, definitely there are increases in rates of mental health conditions that contribute to suicide. But mental health conditions are not the only factors that contribute to completed suicide, which is one of the reasons it's been so difficult to prevent. So environmental factors, other things that you just identified, exposure on the internet to all kinds of unregulated advertisements for young people, all contribute to those challenges. I also want to call out something else that you've highlighted with your question, which is the focus on medications and the focus on pill treatments for young people with mental health conditions discounts the fact that most young people actually need psychosocial interventions. And so that there are multiple environmental factors, psychosocial factors, and other treatment factors that we need to consider when thinking about treatment, not just emphasizing pharmacologic treatments that are available, which I think would diminish some of the focus on young people obtaining medications.
I'm going to go on to another subject, Dr. Benton. In your written testimony, you mentioned the importance of patient-centered medical homes for kids to improve access. 2019, we passed the bipartisan ACE Kids Act establishing pediatric home health for kids with complex medical conditions. Last fall, the Centers for Medicare Services issued guidance for ACE kids and is working with Medicaid programs in the same way. For you, Dr. Benton, is access to out-of-state provider a challenge for kids with complex medical needs? And let me follow it up with what might be my last question. For kids with these needs, what does coordinated mental and physical health care look like? And describe medical home.
So thank you, Dr. Grassley, for your leadership in this area. So the Patient-Centered Medical Home has provided significant support for young people with complex medical conditions. We still have work to do in the area of integrating the medical and mental health benefits and treatments. And so, in the Patient-Centered Medical Home, we do better at providing mental health support for young people, but we still face challenges around parity for mental health and medical services. So within our own institutions, when young people come to us locally or from out of state, frequently the medical benefit is accepted and easily accessible. But when those same youngsters need mental health treatment, they frequently find themselves in a situation where they're being billed for a service that's out of network, or they're not paid at all. And it poses significant challenges for families who deserve the care that their child needs, but the parity issues remain barriers. We've made significant progress, and I look forward to your continued work in this area in leading us through these complex comorbid conditions. We've made progress, but we still have more work to do.
For Mr. Terrell, you'll have to give a short answer to this because my time's out, but what efforts should be taken to address unique rural mental health needs?
Like I said, access to care is super important. And I really appreciate this question just because I think youth have so much stewardship and insight about this issue. So I think if we can really bring, um, personally, I live in a rural community, and what I think would be really helpful is if we bring care to where people are. And that means funding school-based health centers, CCBHCs, and other community-based mental health supports that really help teens just get the support that they need. It's easier to be on a school campus and get medical services than it is to be at home, have to coordinate transportation, and get there, which is a barrier that so many teens in rural communities face.
Thank you. Thank you, Mr. Chairman. I'll commit questions for writing.